The Islamic Medical Association of Mid-Michigan, founded in 1994, continues to do outstanding work in Genesee County. Several prominent physicians and other healthcare professionals describe the IMA's commitment as exceptional and outstanding.
IMA is independent, professional, non-for-profit, charitable, non-political organization.
The Islamic Medical Association is one of Genesee County's largest and most active medical associations. It is dedicated to helping the major hospitals in the area. Some of these hospitals are Hurley Medical Center, Ascension Genesis Hospital in Grand Blanc, McLaren Healthcare Hospitals, Ascension St. Mary's Hospital, Covenant Healthcare in Saginaw, Memorial Healthcare Hospital in Owasso. Healthcare workers have been a pillar in the healthcare sector for more than a half-century and are a pillar in the healthcare community. Muslim healthcare workers account for more than 20% of all healthcare workers in Genesee County, a figure that is nearly 4 times the national average of Muslim physicians in the U.S.
It has been very difficult for us to recruit physicians because, as we all know, there is a physician shortage nationwide. And the IMA is to be highly commended for that. Because of that, the hospitals now are well staffed with physicians thanks to the existence, just the mere existence of the IMA in the area has been such a drawing force.
A career has to be more than just a source of income. Medicine is both a noble profession, it is a way of giving back to the community, and it is also a way of using medicine in the service of humanity.
I am honored to be the first nursing professor and family nurse practitioner invited to join IMA. This clearly shows that IMA embraces diversity, equity, and inclusion principles and is attuned to the need for more interprofessional collaboration among culturally diverse healthcare professionals.
When Flint was experiencing severe hardships such as the water crisis, many professionals left the city. Muslim healthcare workers got together in that time of need to establish a free clinic for destitute locals, as well as frequent food distribution events for those in need. Other healthcare workers coordinated health exams for first responders, as well as diaper and food drives for low-income families and individuals. When the COVID-19 pandemic struck, the IMA stepped up to help residents who needed medical and social services.
When COVID first came, I recall the discussion that we had throughout the IMA. Initially no one knew what to expect or what to come of it. And around that very same time, we actually had just created a networking group to connect all the physicians that we had in one place, over a few hundred different physicians. In those first weeks of COVID, we had hundreds of different messages, shares, posts, and insights onto COVID, what to expect through all different professions. We also realized early on that we're going to need an immediate need for those locally fighting COVID. So we were able to raise over $40,000 worth of personal protective equipment, or PPE, to the local nonprofits, organizations, and of course the hospitals in the area.
They're giving out a total of $450, all worth $25 to nurses, technologists, and therapists at each of Flint's 3 major hospitals. The IMA says they know what it's like to be on the front lines, and while there are many ways to help the community, they felt helping with food was paramount.
Some of our specialists have a positive message to convey about how their field benefits from IMA.
The IMA is very helpful for new providers to the community, not only to get them in touch with a network of providers already here, but as a resource for advice and assistance with setting up their practice, office, and staff. We are always helping each other through our networking system.
Healthcare leadership, medical growth, charity, and relief work are just a few of IMA's endeavors. The association encourages and supports its members in giving back to the Flint community in each of these areas. The Muslim Outreach Free Clinic is also one of the projects. The clinic caters to the low-income community. The following services are provided: free consultation, free diagnostic testing, free prescription fill-up, referrals to specialists if needed. Another IMA initiative run by the American Muslim Community Services is the Flint Muslim Food Pantry.
The Flint Muslim Food Pantry is a community assistance program run by AMCS. A big reason for our continued operations is the tremendous financial and moral support we receive from the IMA and its members.
Previous events have included CME program for healthcare workers, focusing on stroke management and human trafficking, as well as discussions led by area healthcare leaders. Muslim healthcare workers were also instrumental in the establishment of Genesee Academy, a pre-K through 12th grade advanced accredited IB private Islamic school in 1995, which is now one of the area's finest private schools. Many of its graduates are now pursuing advanced degrees in various disciplines of medicine. The IMA is seeing the emergence of a second generation of Muslim healthcare providers. This younger generation infuses the Flint community with positive ideals, a feeling of communal pride, and leadership.
When it comes to the IMA, Genesee Academy has been a great recruiting tool for bringing families to the area, which has bolstered the membership at the IMA. And chicken or the egg, now we have Genesee Academy alum becoming members of the IMA, including myself. And we're at the point now where I can proudly say we have children of Genesee Academy alum at the school today.
It's been amazing. I grew up in Grand Blanc. I'm a Grand Blanc Bobcat. My roots are here in Genesee County. This community gave me so much, and I have been so blessed to pay it back. It's been so rewarding.
Having organizations such as the IMA is so helpful because it provides a really strong network of physicians that connect us, and the focus is being education and promoting the best of healthcare to our community. I've enjoyed building a practice here in Flint, and I look forward to further growth and collaborative care in the years to come.
Over the last 3 decades, the IMA members have been able to provide medical education and leadership and training to not only the future doctors, but also medical residents. And now the IMA members and future generations are coming back to supporting and practicing clinical care in Genesee County, making sure the legacy of IMA remains in place.
I am very proud to say that our community has over 40 nationalities from around the world, and our diversity is unmatched. Now our Genesee Academy graduates are taking the baton in supporting this community and IMA in providing the best quality of healthcare in Genesee County and the local area, and also supporting the food pantries and free clinic that we offer.
IMA's goal is to keep the Genesee County community nourished and supported today, tomorrow, and in the future.
With our 255 IMA members, we cover almost the entire healthcare scope, from primary care physicians, hospitalists, subspecialists, mid-levels, dentists, physical therapists, hospital administrators, and home health care and extended care facility experts as well. Our IMA community took root in mid-Michigan since 1994, with the key initiative to help out the community at large in mid-Michigan with variety of healthcare services and needs, supporting our current and second-generation young Muslim healthcare providers with their practices, teaching them the blueprints to get their feet on the ground and let them have good niche in the medical community. Our new January 2021 IMA board released our first ever IMA newsletter, both in hard copy and electronic version. We've committed to release an IMA newsletter every 6 months. That's been pretty informative to the community at large.